Okay, well, welcome everyone. Thank you for joining us for the 2024 Massachusetts Advocacy Day, our virtual training session. We're going to get started with today's program, and it's brought to you by the American Foundation for Suicide Prevention Massachusetts chapter and the Massachusetts Coalition for Suicide Prevention, or MCSP. Well, here's an overview for our schedule today. Our goal here is to empower you as a suicide prevention advocate by highlighting some suicide facts and figures for our state and nationally, by explaining the policy priorities that we will be promoting as part of the event and reviewing ways that you can help take action, and finally, by answering any questions that you may have. We do kindly ask that you go ahead and mute yourselves for the duration of the program if you're not already, and also that you hold all questions until the end of today's program. We'll have plenty of opportunity to answer those questions, and can also follow up via email afterwards as well. So to get us started today, I'd like to welcome Jennifer Kelleher, from the Massachusetts Coalition for Suicide Prevention, and Nancy Farrell from the American Foundation for Suicide Prevention Massachusetts chapter. Jen?
Welcome, everyone. Thank you so much for joining us. This is our 8th annual and 4th virtual MCSP and AFSP Advocacy Day event. We're aware that for the past few years, we've all been dealing with unprecedented circumstances none of us could have anticipated. And during this time, mental health and suicide prevention are more important than ever. We know that social isolation, health anxiety, racism, and economic insecurity have always been potential risk factors for suicide. But since the pandemic, these have been immeasurably amplified. And our member organizations have been working tirelessly to provide as many resources and as much support to communities across the state as they can. We all know that suicide prevention is always critical, and suicide prevention saves lives, but it's never been more important than it is now to make sure that our voices are heard and that we maintain these essential services in our communities, especially funding for 988, which you'll hear more about later. This event is representative of the extensive collaboration in suicide prevention across the state, not only between MCSP and AFSP, but also with many of our other member organizations. And I want to thank the planning committee for all of your work to make today possible. Every year, this event highlights the importance of suicide prevention across the state. And it's really a testament to the dedication of and the strength between collaborators, community partners, service providers, survivors of suicide loss and attempt survivors, and other stakeholders. Our strength in advocacy as a state and as a coalition comes from the fact that we are truly statewide, and we represent the interests of communities across Massachusetts, from the Berkshires to the Cape and everywhere in between. We have 10 regional coalitions that cover almost the entire state except for Norfolk, which we're working on, and most of whom will be represented here today. Because of this unique strength in our advocacy efforts, and because suicide is an issue that impacts every demographic and every community, and most importantly, because of the tremendous support of our legislature, Massachusetts is actually one of the highest funded states per capita in suicide prevention in the entire country. And I believe it's because of this that we also have one of the lowest suicide rates. We rank 47th, I believe, out of 50 states in DC in suicide rate. And this is not only a credit to our legislature and the resources they so generously give us, but also to the wide array of prevention, intervention, and post-prevention services that are available across the state. And it also speaks to the unified mission and purpose of all of us here today who are doing this work. We're all here to reduce suicide. We're all here to save lives. But for this work and these collaborations to continue, it's essential that legislators hear from their constituents, from you, about the impact of suicide and suicide prevention on their communities and the individuals they represent. It's equally important that they continue to hear how the services funded through the line item benefit their communities, so they can truly understand the importance of maintaining consistent service delivery that ensures individuals and communities continue to be reached and lives continue to be saved. Today, you'll hear from speakers who will help prepare you for these conversations, and you'll also be provided with virtual packets for both yourselves and your legislators or legislative aides. We also encourage you to sign up for in-person visits, which will happen on the 23rd. You can RSVP to the link you got this morning, and you will also be getting that link again later. I just want to thank everybody for using your voice, your story, and your experience to humanize this critical issue, and for helping to hold the memory and stories of all of the people in Massachusetts who have died by suicide, who have survived attempts, who have been left behind, and who continue to struggle. And in sharing your stories, I have no doubt that your voices will, in fact, save lives.
Jen, thank you for speaking so eloquently about life here and what we're doing and what we're planning to do. Stories are the essential part, I think, of our lives. And going into the State House, carrying those stories makes us very powerful. One meeting with Congressman Kennedy, when we went to see him in DC, he said that if he got 5 to 10, if his office got 5 to 10 comments on something, his staff had to let him know, and he had to look into that issue. So that's one of the reasons we do what we do. At AFSP, we have a strong emphasis on advocacy, and we're really pleased to work with the coalition to implement that emphasis and to make it more powerful. I'd like to tell you just a little bit about AFSP, and if you're not familiar with us. We're a national organization dedicated to saving lives and bringing hope to those affected by suicide. We do that by funding scientific research, educating the public about mental health, advocating for public policies in mental health, and supporting survivors of suicide loss and those affected by suicide. Most recently, we got involved with the firearms legislation in the State House, and our goal at that point was only to propose amendments that would affect safety. As you all know, firearms are commonly used in the majority of suicides, and so it was really important to be present at that time in the State House. And I'm happy to say that we had several amendments with your support. We had several amendments that were filed and accepted and are now part of the conference committee discussions. These are the ways, which are really not hard. Everyone says to me, oh, the State House, it's so daunting. I always want everyone to remember they work for us. They should hear from us. And what we have to say is, as Jen put so well, so important to everyone who lives in the Commonwealth. So thank you again for joining us. Please tell your stories. And I'm looking forward to the rest of the presentation and meeting you, hopefully in person on the 23rd. Thanks very much.
Thank you, Jen, and thank you, Nancy. Today's event would not be possible without the collaboration of AFSP and MCSP, and of course, all of you as suicide prevention advocates involved in this fight. I love what you said, Nancy, about they work for us, and that's something to remember. It can be a little intimidating meeting with legislators and state representatives, but ultimately they want to hear from us. So excited that you can be part of today's event, and really hope that you will join us on April 23rd. So to dive deeper in today, we're going to talk a little bit about why we fight for the cause. And to do that, I'd like to invite Karen Carrera from the American Foundation for Suicide Prevention, Massachusetts chapter, Board of Directors, and the Advocacy Committee.
Thank you, Jessica. Part of what we're doing today is really preparing, right? And so we're taking the time to understand what our role is, how going to the State House is really important, empower ourselves with those choices that we're making, and then bring along some data and some state and national statistics to help support the stories that we're going to also share with our legislators. And so right now, we're going to take a few slides to talk about what is happening in the area of suicide and suicide prevention in Massachusetts and across our nation. Next slide, please. So suicide in the United States. When we're looking at data and statistics, we are really considering them from a source from the Center for Disease Control and Prevention. We call that the CDC. They collect and share the data on the number of suicide deaths in the United States each year. This typically takes 2 years. Right now, we're seeing it at about 3 years' time for this data to be published. So verified, published data to be a part of what we can incorporate in our conversations and our collaborations across our work. What you're seeing in front of you right now is data, the most recent verified published data from 2021. We are in 2024 right now. I understand that. And there are some other sources of real-time data that you might have access to. When we're going into the State House, we're talking about these subjects and you're advocating with your story, we're going to lean heavily on this verified data and the CDC statistics. So let's look at that for a little bit. In 2021, suicide was the 11th leading cause of death in the United States. So that's nationally. We're looking across all 50 states for this information. There was an estimated 1.7 million suicide attempts. But then let's look at that compared to the 48,183 Americans that died by suicide in 2021. In the work that we do, one death by suicide is one death too many. And so considering that almost 50,000 Americans died in 2021, there's a lot of work to do, and we're very grateful that you're here to help us do that. For every one, the estimated data for each suicide death is that there were 25 attempts. And so when we do the math on all of that, we're looking at 1.7 million suicide attempts in addition to the people who have died by suicide. There's a lot of work to do. And we're here together to do it all. 94% of Americans surveyed in the United States think suicide can be prevented. That's an incredibly important fact because that's why we're all here doing this work. Prevention is possible, hope is available, and your voices and what we do with our legislators in the State House, in our communities, frankly, is going to help turn the tide and save more lives. Next slide. Here's a different picture of some national statistics. Each state categorized on the left. You can find this data sheet on afsp.org/statistics, and it shows you what's happening across our nation. As Jen mentioned, Massachusetts is doing very well in the fight against suicide. Again, I say every death by suicide is one death too many. And so it's important that we share that with everyone. So you can find that and download that put it in your folder and bring that with you when you're having your conversations. And additionally, we have some very specific stats and statistics on what's happening in Massachusetts. Locally, we lost 604 individuals to suicide in 2021, making suicide the 19th leading cause of death overall in Massachusetts. 19th leading cause of death overall across our state. Let's go to the next bullet and look at the second. It's identified as the second leading cause of death for ages 10 to 24 and 25 to 35. And that is, a statistic that unfortunately has remained somewhat consistent over the years. So youth work and youth suicide prevention is definitely a part of our conversations. The last bullet of consideration and to think about in your conversations is this 59% statistic. 59% of communities did not have enough mental health providers to serve residents in 2023. So that's real time, according to federal guidelines. Those kinds of lack of access to care, whatever barriers that we're having, the people have to accessing that care, is a significant connection to the mental health struggles and the suicide prevention work that we do. Please take all of these data stats and statistics with you and interweave them in the stories and your personal story that you will share with your legislators. Next slide, please. And one final data sheet that is available for you, again, at afsp.org/statistics, is the fact sheet for our state. AFSP creates one of these for each of the states. We have chapters in all of our states. This is what Massachusetts looks like. So having this at your fingertips, having this visual cue, this access to this data will really help your conversations going forward. Please download this. Please bring this with you and refer to it as we have conversations in this advocacy time. Thank you very much. Back to Jess.
Thank you, Karen. Well, now that you know the numbers, it's time to learn more about the legislative priorities that we have this year in Massachusetts. So joining us now is Marty from Womble-Bond. I practiced this one too. Womble-Bond Dickinson Government and Public Affairs. Marty.
Thank you, Jess. And for the record, it's now been 3 years at this firm, and I still can't say the name properly yet. So you're not alone. So this year, we'll be asking legislators to follow the leadership of Governor Healy by supporting the governor's recommended fiscal year 25 funding for the DPH line item, which is 4513-1026 for suicide prevention. We're going to be asking for the funding level at $14,191,372 exact, which will, among other things, help to support the 988 implementation across the Commonwealth. We will also be asking legislators to support House Bill 1999, which is an act relative to student mental health. This would require that public and charter schools, grade 6 or 12, and public and private colleges and universities across the Commonwealth print the 988 Suicide and Crisis Lifeline number on student ID cards. And we'll touch on this in a second. Now, why is supporting the governor's budget recommendation so important? Well, state funding supports suicide prevention programs implemented through state agencies, private vendors, and coalitions that provide prevention, intervention, and postvention services throughout the Commonwealth. Funding is also used for innovative programs such as peer-to-peer support and social justice and racial equity initiatives and other upstream interventions. These programs provide targeted support for veterans, the elderly, LGBTQ populations, and youth. The governor's recommendation, which is essentially level funding, significantly impacts suicide prevention across the Commonwealth, particularly the continued implementation of 988. Now, as we know, 988 was implemented on July 16th, 2022, and the 988 Suicide and Crisis Lifeline is now operational nationwide and, of course, across Massachusetts. 988 is free, it's confidential, and available 24/7, 365 days of the year. But more importantly, the full rollout of the 988 Suicide and Crisis Lifeline and rising demand for crisis services cannot realistically be met without continued financial resources for the infrastructure, ongoing training, policy and protocol development, and of course, staffing and supervision. Finally, as mentioned relative to the priorities, we wanted to bring to your attention a bill that is moving in the House, and that's House Bill 1999 as referenced. Right now, it's in the bill, currently in the bills in third reading. The bill, as I mentioned, would require that student ID cards contain suicide prevention lifeline contact info. So we are asking members, House members in particular, to please vote yes when this bill moves from bills in the third reading to the House floor. That's the next step. This bill has been reported favorably by mental health, went through steering and policy, and now is in bills in third reading, which is the final step before it goes before the members for a vote. So we're asking that when that bill does reach the floor, the members vote yes. Now, all of these talking points should serve as a template for your discussion when you take legislative meetings. So what to expect with the legislative meeting? Let's get into that. Each meeting, whether it is with a legislator or a staff member, is important. We talked about this earlier. Nancy mentioned this earlier. Always address a legislator by their title, senator or representative. Introduce yourself. Thank the person, whoever you're meeting with, for taking the time to meet with you and let them know why you're there. Use the talking points that we have referenced as sort of the foundation for your conversation. But more importantly, if you are willing, please feel free to share any personal stories or experiences and how they may have impacted you and your family. At the end of the day, these meetings are all about making a personal connection and putting a face to the importance of suicide prevention funding. At the end, ask them if they have any questions, but please remember, do not answer any questions which you do not have the answer to. We can always follow up. Simply let that person know that you don't have the answer at the moment, and we'll be sure to reach back out with those answers. Whatever meeting you're in, leave them with the materials provided and let them know you'd be happy to provide them with any additional materials they may need. Now, if you've met with a staffer or a staff member was in the meeting with you, and a legislator, ask for that staff member's card. This will be important just for follow-ups and contact. Thank your meeting participants again for their time and their support. And then, this is why we want the card, send a follow-up email thanking the appropriate staffer for meeting with you or even just setting up the meeting. And of course, let them know that you're available if they have any questions or would like any additional resources. It's pretty simple. As Nancy pointed out, they're there for us. And more often than not, they're more interested in hearing from you than you are going to meet with them. The information is crucial to them as they move forward with any decision-making processes that they need to go forward with. So remember that they do work for you, but at the same point, just be respectful of their time as well. Happy to answer any questions at the end. Thank you, Jess.
Thank you so much, Marty. I remember my first legislative meeting, it was probably 2010, 2011. I lost my dad to suicide in 2008 and got involved with AFSP shortly after. And I remember feeling super intimidating, feeling like I have no experience in public policy. Why would anybody want to hear from me? But as you explained, Marty, it's really about building that connection and putting that name, that face, that story to why we fight for suicide. So know that going into your meetings, even if you are a little nervous, and also know that you don't have to have all the answers. The main thing is to build those connections. And if there are questions that you can't answer or additional information is needed, bring those back to us and we'll help you get the information that is requested. And to talk a little more about the experience of what it will be like having a legislative meeting is Lindsay Nunes from the American Foundation for Suicide Prevention Massachusetts chapter, our board of directors, and our advocacy committee.
Thank you, Jess. I'm really excited to talk to you all today, and thank you all for taking this time to be with us. If you could just go, perfect, thank you. So after today's program, you will be provided with materials listed here on this slide. We understand that suicide prevention advocates come from so many different backgrounds. Some have lost a loved one to suicide, some have had their own struggles or support someone that struggles, and some are professionally invested in this space. During a legislative meeting or whenever we are talking about suicide, it is very important that we use safe messaging. And a big piece to remember is that we ourselves, we should be in a safe place in our own recovery. You should avoid discussing details and the methods, as this could be triggering to those around you. Avoid glorifying suicide by using terms like successful attempt, but instead say death by suicide. Avoid using the word commit, as we often relate this word to crimes. Instead, we say someone died by suicide or took their own life. Share mental health resources such as the 988 Suicide and Crisis Lifeline or the Crisis Text Line. Finally, practice. As Jess said, it can be very overwhelming and nerve-wracking if it's your first meeting. But the more comfortable you are in sharing your own story, talking about suicide, the more we can break the stigma associated with mental health and suicide. After today's program, you will receive an email link to RSVP to join us on Tuesday, April 23rd at the Massachusetts State House on Beacon Hill. We will help you set up meetings with your state representatives and senators, but this is your opportunity to put a name, a face, and a story, and ultimately a reason to vote in support of suicide prevention and mental health. For those who are not able to join us at the State House on April 23rd, there are several ways that you can continue to advocate. You could set up virtual meetings or visit a regional office. You can visit our AFSP Action Center and send an email to your legislators. You can also encourage your family, friends, and those in your community to do the same by sharing a link to the Action Center on your social media channels and tagging hashtag AFSP Advocacy. If your availability changes and you would like to join us in person on April 23rd, please let us know as soon as possible. We are always willing to make space for those advocates who want to come and share their story. Remember, though, there are lots of ways to use AFSP's advocacy tools to build relationships and stay connected with your lawmakers throughout the year beyond today's event. As a volunteer suicide prevention advocate with AFSP, you'll receive emails from the AFSP public policy team that will prompt you to email members of Congress and state legislators through our AFSP Action Center. It's very easy. In addition, you can find out what your legislators are doing locally to support suicide prevention and mental health by signing up for newsletters and following them on social media, so you know when they are hosting or will be at events in your area. And finally, AFSP offers several resources all in one place to new and seasoned advocates at afsp.org/ /advocacy resources. On this page, you'll be able to view training videos, including the sample legislative meeting video you would have watched prior to today's program. You can view current laws in your state and legislative priorities at the federal and state level under the legislative resources section. You can read issue briefs on some of our top policy areas, and you can also watch previous webinars and read recent blogs done by Public Policy Office and some of our volunteer field advocates.
Perfect. Thank you, Lindsay. And thank you to all of our speakers and community partners who have helped to organize today's program. We'd be happy to answer any questions at this time if you would like to drop them in the chat box. And we'll do our best to cover them in the time that we have left. We do have a special video at the very end. We'd have to answer any questions, whether it's about the content that we shared today, priorities, or about arranging meetings in your local community. So I do have one question, if anybody would like to take it, maybe Lindsay, Nancy, Karen. What is the best way to schedule a meeting?
I can take it, and I apologize. I live in front of a train, and it always goes by, never fails, every time I'm on Zoom and it's my turn to talk. So the best way to schedule a meeting, if you are going to be coming to Advocacy Day on the 23rd, we will help coordinate and schedule your meetings and have as many of those situated and have a schedule for you when you arrive. If you are unable to attend on the 23rd, I am happy to support and help schedule, but I've had many advocates in the past just reach out to their legislator, often as the legislative aide, and they will help coordinate and schedule the meeting. I have found that the legislative aides are beyond helpful and will always often work with you. Virtual meetings tend to sometimes be a little bit easier to schedule given different, people's schedules and getting to and from offices, but in person as well if you're local to the office. And so the best point would be starting with us if you're going to be there on the 23rd, or reaching out, and we can help connect you via email, or even taking it upon yourself to just reach out to the legislator. And a lot of them also have like schedule appointment or, speak with your legislator tabs on their web pages, and it will bring you right to a scheduling.
This is a great question. Can you reach out to state legislatives in other states as well? Or if you're a resident in one state, should that be your main priority?
Yes, I would say that should be your main priority. Although if you have a vacation house somewhere or you spend a lot of time somewhere else, feel free. AFSP chapters in states around the country are doing exactly what we're doing this month, having events in which we bring important information to our legislators. So I don't know, does anybody disagree with that? It just seems like if you can vote for them, they want to hear from you. So I think that's really the prime reason.
Yeah, and I know sometimes, students that may go to school in one state, but actually, technically live in another state, participate in both. I would say if you, live, work in another state, get connected with your local AFSP chapter, because this is we're one of 74 chapters across the nation that do advocacy days or state capital days. And there's always opportunities to get involved. Most of them are in the spring, so most of them are happening right now. So some of the legislators you may not know. So someone was asking for a little guidance on April 23rd. I'll start, and if anybody wants to jump in. So this will be the first time that we're actually gathering back in person post-COVID. So we're kind of creating the event as it comes together. We're hoping for a big turnout. We'd love for everyone that RSVP'd for today's event to join us. But our plan is to have a briefing in the morning at the Aldrich Center, which is with walking distance of the State House. We have a great room reserved. We'll have a little continental breakfast. That's where you can pick up your packet materials. You can get any questions answered. You need a refresher on anything. From there, you'll head over to the State House for your legislative appointments. And if we can't get appointments, we'll also do drop-offs. And sometimes the drop-off turns into an appointment, or you just leave the information for follow-up. So no matter what, we'll definitely be able to stay busy for a few hours on that day. So hope lots of people will join us. So, yeah, go ahead.
I was just going to say, I got a great question directly to me about meetings, just to circle back. We will do the best if you register an RSVP for the 23rd, that we will do try to have the schedule set for people to go to meetings. If you're unsure if you're going to be able to attend, and that, as we said, and your schedule changes and you can come that day, please let us know and we will still have you come. If you're unsure if you're ready to even go have the meeting yourself right away, you can also drop us a note, or we will then pair you with a more seasoned advocate as well. And so please know we want you to have the meetings, but we're also not going to put anyone in a situation that they might not be ready for. And we have wonderful advocates who are someone like Nancy, who I think I've learned so much from, who I kind of, piggybacked on her meetings and then learned how to have them. So we are here to help support you wherever you are at in your advocacy journey.
And the other thing I might add, Lindsay, is that your legislators have offices, outside of Boston, particularly when they're from, other areas, and they have meetings there, and you can stop by with your packet there if you'd like to, meet your legislator and you haven't met him or her yet. So that's another way. Sometimes I think legislators remember people they meet in the district better than the ones in the State House. So, it's worth trying both ways. So that's another way to get connected.
Yeah, and virtual is still an option as well. If you can get an in-person meeting or your schedule's a bit tight, virtual is still available as well. I know that's last year, that's all we did really was virtual. So that is still an option. So
I can take that next question, Jess.
Yeah, you want to take the next one? So are there
yeah. So thank you,
Are there
Mike.
any stat sheets with information for communities such as military veteran suicide rates and data?
Yes, absolutely. There are. And sometimes it can be a little difficult navigating through different sites. So the best way that we can help get you the most accurate information and ease of navigating is go to AFSP.org. And you are going to go to learn the facts. And then under that, you're going to look at suicide statistics. And there are a bunch of different links you can click that will link you directly to the CDC. So their website, how we're publishing the data fact sheets for state and for other demographics taken from the CDC material. So they'll take you directly there, or you can look up Massachusetts here. There are statistics specifically for veteran suicide and military as well. So it's a great place to start that'll take you to many different channels to gather the information you're looking for.
Can I get the packets mailed to me? So we will provide them. So the question was, if you're not able to attend the 23rd, but you definitely want to do a local or regional meeting, can I get the packets mailed to me? We will provide them digitally, and let me follow up on mailing them to participants. Let's figure out logistics on that, and I will get back to everyone. But we'll definitely, after this meeting, you will get everything digitally. Any other questions? Yeah, the AFSP website is a great resource. As mentioned here today, there's a lot of information, additional trainings. And since you registered for today's event, you have been registered as a suicide prevention advocate.
And let me just add that if you get an Action Center email from AFSP, it would probably take you about 3 minutes to read it, to decide if you want to support it, to add your own paragraph perhaps, which is what I often do, and then press send, and then we take care of the rest. So again, if you try to send a letter to Congress, for example, nowadays it takes forever because it has to go through such deep security. But these emails which come in, especially if you take a minute of that 3 minutes to personalize it, really make a difference, I think. And in Congress, they pay a lot of attention, and I know they do here as well.
So if you do have any other questions after today, feel free to follow up with us. You'll also have the contact information in the email that goes out after today's meeting. Once this video compresses and formats and all that fun stuff, we'll send out the recording as well. And great news, we were a little concerned about timing. This is perfect. So to end today's program, we just really like to thank everyone for joining us. We truly appreciate your passion and dedication to advocating for state policy funding, policies that will ultimately improve mental health and prevent suicide. We're going to wrap up our time here today with a really powerful collection of real voices, and I say that strongly, real voices from our 988 community partners across the state, as well as Congressman Seth Moulton. The video is about 11 minutes in length. Thank you to Jen for putting it together. I know she dedicated a lot of time and energy into putting this beautiful piece together. So we hope you will join us for the duration of the video. And then, of course, it will be included in today's recording that will be sent out afterwards. After I turn off my camera and stop sharing, I will drop an event survey into the chat box. If you have a couple minutes, we'd love for you to submit that survey. And again, if you have any questions, do not hesitate to follow up. Jen, I'll hand off the screen sharing to you.
All right, let me just make sure I don't share my entire messy desktop. And let me know if you can hear the sound.
Being a call specialist on the 988 crisis line is not merely a job. It is a commitment to being a lifeline for those in desperate need. I play a pivotal role as a call specialist in offering empathy, active listening, and guidance to individuals facing mental health crises. Being a call specialist means being a beacon of hope, offering supportive and non-judgmental space for individuals in their darkest moments. My choice of being a 988 call specialist is motivated by a deep sense of purpose and a desire to make a positive impact on the lives of those in distress. It is an acknowledgement of the importance of mental health and commitment to breaking the silence surrounding it. Every call I answer is an opportunity for me to offer comfort, understanding, and potentially save a life. I think it's a lifeline that everybody should embrace.
My name is Jessamine Leeks, and I'm the Crisis Line Coordinator for the Samaritans on Cape Cod and the islands. No two callers were the same. I could start my shift talking to an elderly woman in a nursing home who wanted to share her life story with me, and end my shift waiting for paramedics to arrive as I tell a teenager that they made the right choice by calling us. I sought out to work for a crisis line because I myself am a survivor of suicide loss, and I wanted to prevent others from experiencing the pain my family and I have felt. Not a lot of people think about what goes on behind the scenes at crisis centers, but between the data analysis, oversight of operations, training, increasing public awareness, staffing, etc., there is a great deal of work happening aside from the most important aspect, which is, of course, answering the phones. I can tell you that we are doing the absolute best that we can with what we have, but we could be doing better if we had more to work with. Our center has answered 18,000 calls in 2024 alone, and as difficult as it is, we need to answer more.
My name is Michelle. I'm a crisis counselor for the 988 Suicide and Crisis Lifeline. I have been working with this organization for 5 months. As a community, we need to have 988 for people to reach out when help is needed or they are in a crisis. A call to 988 can be life-changing and in some cases life-saving. I am very grateful to be part of a team of caring individuals who want to listen and help people who are having a crisis. I'm very appreciative to be part of an organization that dedicates their time to helping individuals in need.
Just a few years ago, we were a volunteer-driven crisis line. Now, where we have over 60 plus staff and volunteers who answer calls remotely each month, up to 10 to 11,000 calls each month. I find hope in the gratitude when a longtime caller expresses that they know how much we care about them. I find hope when our staff is able to de-escalate someone who is at imminent risk for suicide. And when we do a follow-up call the very next day, just to check in to see how they're doing, they say, "Thank you. You saved my life. Thank you for caring about me. You gave me hope."
Hi, my name is Tara. I'm a supervisor for the 988 Lifeline and have been working for the Lifeline for about a year and a half now. 988 is so important because we are able to give callers a safe space to talk about whatever they're going through, whether it's something minor all the way to something major. And we are usually the only people they can talk to. We often talk to people who feel like they are at their lowest points, whether they're feeling suicidal or they just can't handle things anymore. It's not easy for them to call us and seek out help, which can come in many different forms. I understand how it feels to be at your lowest point and feel like you have nothing left in you. But at that time, I didn't have anyone to talk to or anyone to reach out to. Had I had a line like this, I would have felt better about my situation, knowing that there was help out there and knowing there was somebody for me to talk to. If I can be that safe space for someone to talk to, and I know I can help them out in any capacity, I know I've done my job well, and that makes me feel really good. At 988, we are able to provide that safe space for somebody who is feeling suicidal or struggling with a mental health crisis. We are able to provide them with valuable resources and immediate help if necessary. Sometimes all it takes is one phone call to save someone's life, and that's what makes 988 so valuable.
Call the Talk is a suicide prevention, mental health, and emotional support program. We are so very proud to be part of the 988 network. With the cooperation of the Department of Public Health, the support of 𝑒𝐻𝑆, and many other Massachusetts supportive entities, we were able to build capacity to add to our call taker staff and be able to answer the demand for all 988 calls coming through. How wonderful it is to hear our phones ringing, to hear our highly trained call takers answering 24 hours a day, 365 days a year. It is a very happy, cooperative, and collaborative center where call takers strategize on how to best meet the needs of all our callers.
My name is Maria, and I have worked for 988 since August 2023. 988 is important because the mental health system is broken and people just really need to talk about their problems. I do this because I had a friend suicide because they thought they were alone. No one should ever feel alone. 988 is for everyone, from the homeless to the President of the United States. I feel that without 988, I think many more people would be lost and distraught. I am glad 988 is out there for people who need it, who take advantage of it, and are able to know that we are out there for them.
We know that the sustainability of the services we provide depends on reliable funding. These crisis lines have always been a vital link to the most vulnerable people living in our communities, those who are suffering from mental illness, substance use disorder, loneliness, isolation, and these are often coupled with financial and housing insecurities, poverty, chronic illness, and grief, just to name a few. They call us in their darkest hours. They call us when feelings of loneliness and isolation and despair wash over them. We provide them with that critical connection that lets them know that they're not alone. We are a source of hope for them in a world where often they feel only darkness. We are a source of referrals to mental health and substance use resources within the community. And we know that when people receive care in their community, the outcomes are better. And because we are an integral part of the mental health landscape in our community, we need continuous funding in order to improve the lives of the thousands of people who call into our center each month looking for that supportive connection.
We cannot keep up with this demand, this ever-growing demand that's exponentially growing each and every day without your support. With your support, 988 is able to answer calls from emotionally distraught individuals, individuals experiencing suicidal ideation, older adults or young folks, children calling as young as 8 years old who are feeling lonely, isolated, bullied, alienated, and like I said, experiencing anxiety and suicidal ideation. Depression is real. It's okay not to be okay. And 988 is an easily rememberable number that individuals can call at any time during the day or night and get a compassionate, non-judgmental individual that can listen to them, meet them where they're at, and potentially connect them with other additional resources, such as 211, 911, and other mental health, behavioral health services. Please, we all implore you, all of us here in the 988 network, please don't let our callers and the residents of Massachusetts down. Continue to fund this very important number and sustain what is so becoming a national model for call centers.
Sometimes our lines get backed up from so many people calling us. The call gets transferred out to a backup center after the caller has been waiting for 120 seconds. However, sometimes I see callers hang up before they are transferred. Anytime that happens, I think to myself, what if that was someone like the girl who needed 3 hours of convincing before she let me save her? What if it was someone like my brother Jared, who was about to make a decision that devastates their family forever? With increased funding, we would be able to answer those calls. We would be able to provide increased training for our teams to make sure they are equipped with the skills necessary to save those callers' lives. We could implement new projects and try new ideas to make our crisis lines the best they can be. And we would spread the numbers 988 to everyone who will hear them and hope that those who need us are listening.
Hey everybody, I'm Congressman Seth Moulton. I'm a Marine veteran and co-author of the bipartisan 988 legislation. I worked with an Air Force vet from Utah to get this passed, and the results have been incredible. In the first year and a half of its operation, calls are up about 50%, but texts are up over 1,000%. That's, of course, a great measure of how many kids are able to prevent mental health issues and suicide by getting help when they need it. Of course, it's also a sad measurement of the need. These are impressive statistics, and when I was speaking to a school group recently on the Capitol steps, I shared them with these kids to show that the work we're doing in Washington is having an impact on their lives. I don't know if it resonated that well with a group of middle schoolers, but then I turned around to leave, and a woman came up to me and said, "I'm sorry to interrupt, sir, but I want you to know that your bill saved my daughter's life." And then she introduced me to her 13-year-old daughter. One of the many debates that we had in putting together this legislation and making it bipartisan was how it would be operated. Would this be a federal service? Would it be state by state? The decision was made to do it state by state, much like 911, the model for 988 in so many ways operates and always has. But that means it's up to states like Massachusetts to step up to the plate and actually provide the services that the people of Massachusetts need. You have a real opportunity to do that and make us the best state in the nation when it comes to mental health care. Never forget, this isn't statistics. This is real people. We owe it to them to get them the help they need.